Welcome to The Better Life with Dr. Mariane Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mariane Pinkston.
Hello, Happy New Year to everybody out there. We are starting off the new year running, and I literally, right? So I am very honored to have a repeat guest on my show, and this is Mr. Kyle Sinclair, who is CEO of Warm Springs, Thousand Oaks. I want to make sure I do that right for him. Also a Republican nominee for District 20 and running for Congress. So I'm very excited to have him on board with me today. And, you know, we've got a hot topic.
We do.
Welcome. I'm glad to have you on.
Thank you. Thank you for having me.
You doing well?
Absolutely doing well.
Yeah? You're running all over the country doing
all over the city for sure. And you know, healthcare is busy. And then
it is, yes.
You know, running for Congress keeps them busy as well. So.
Absolutely. Well, I'll provide some information for everybody so they can look you up there and see what's going on. But so, you know, COVID's on everybody's mind. And we're not going to get away from it anytime soon. Yeah. But we probably could pick 100,000 million topics to talk about, and probably will cover quite a few of them anyway this morning. But I think the hotbed we were wanting to visit about is about some of the shortages and the lacking in healthcare right now, how access to medicine, access to care, good care, and access to testing supplies. You know, I think somewhere in my mind, forever ago, I think it was when Kobe Bryant died, there was the same day that he was in the USA Today. I have a picture of it too, because we hadn't hit we didn't do it until March, I think is when we shut down. And then there is a little story in the very bottom corner that says, rush for a vaccine for, you know, COVID-19. Yeah. So we knew then, we knew before, we knew it was happening in the world before. Is there not some way we could have prepped and planned for this a little bit better?
Yeah, I mean, so a couple things I'll mention. Number one, all vaccine and distribution is at the executive level, right? So there are a lot of discussions about that in regards to unfortunately, this is not just a medical issue. This is a federal government issue as well. And they control the distribution and supplies of it. And so, yeah, I mean, I keep constant, because I'm in both worlds, right? Right. I keep constant watch of it. But yeah, we should have seen this coming. We knew it was coming. Dr. Fauci even mentioned it from NIH that there's going to be more variants of it. Right. And as most people know, as you know as a physician, that when you have a virus, and that's what this is, it's a coronavirus, it becomes, when it mutates, it becomes more transmissible and less lethal, right? And that's typically what you're seeing with this now Omicron variant. It is very transmissible, regardless if you've had the vaccine or not. Right. Right. And so for many months and almost probably a year, it was about, you know, get your vaccine, get vaccinated. And it was a big topic of, you know, the vaccinated versus unvaccinated. Well, unfortunately, the Omicron doesn't care if you've been vaccinated or not. And so people that are vaccinated are spreading it and sharing it just as much as unvaccinated, right? But shortages of supplies. We have, you know, I know last week, Brook Army was a 4-hour wait just to get a test. Yeah. You can't get tests even at CVS or Walgreens, right? Exactly. My wife, who's a nurse practitioner, can't get into facilities without a proven test that week, right? So unless we have stock on house, she can't go into the facility, right? Right. Yeah, so there's a lot of issues, and it's a problem. It is a problem. And I was speaking to you, you know, previously about how not only do we have shortages on testing, but we have shortages on staffing at hospitals and clinics. And I was, you know, expressing to you about a patient I have currently, and her father is in the hospital after having open heart surgery on the cardiac floor now of one of the hospitals, and is unable to get an appropriate bed for him. And he was healthy coming in, and now he has bed sores and, you know, unable to get his pain medications, and there's shortages of everything. So what do we do? Where do we go? Yeah, I mean, so there's a couple of things. Number one, I can't speak specifically to his case. I'm not involved or aware of it, but nor am I actually. It's just, you know, secondhand knowledge. But it opens up I guess a can of worms and problems we're seeing in healthcare, right? So not only do you have shortages, you have Omicron that's hitting everybody. I have staff that are getting it. I have hospitals are getting it, right? So every industry, right? I mean, I saw Bill Miller's closed all their locations, indoor locations. I went to Starbucks yesterday. That was closed,
exactly.
Right? So,
and you can order online before too.
Exactly.
And show up in a
so you have shortages of staff and personnel, right? And so that's a problem. I keep close tabs with STRAC, the emergency management that manages this city and manages multiple other counties, but it manages Bexar County and the shortages of bed. It's not necessarily the bed; it's the staff. We have staffing problems, right? Yeah, exactly. But you gotta go 6 months ago, maybe 8 months ago, when there was a major push to terminate nursing and medical staff if you're unvaccinated. Mm-hmm. Right, so you create yourself an issue on top of what is already happening.
Right.
But they stopped, elective surgeries for multiple reasons, for blood conservation, for staffing, for bed, for all sorts of other
issues. It's the third time that's happened.
It's the third time.
And we're getting backed up. And so, I had made mention of the fact that I feel like, I know it's not entirely, but I feel like we're, in a third world, country, almost, maybe not third world, but socialist even type. Yeah. And I know it's not all that bad, but it sure feels like it.
It does.
Yeah.
So it definitely feels like in some parts of it. I know personal friends that haven't got surgery because of what's going on, right? I was vaccinated and unfortunately got COVID myself, and so I can see how if you have a comorbidity or multiple issues going on, we use the word comorbidity, but your audience may or may not know that word, but multiple issues going on, I can see how you can get in trouble fast.
Yeah, you can. And for instance, I've said many times I have rheumatoid arthritis, and that doesn't necessarily make me immunocompromised or my immune system, fails easy. But what I'm on is a medication that does it. Yeah. So that has rendered me, pretty frightened of getting COVID. I mean, I'm not, frightened of it. I'm still in my clinic. I'm out there. I live my life, but I am underneath very frightened. And so, I too elected to do the vaccines. And I know there's some great studies. I've been studying all weekend, trying to catch up because I try to educate people as much as possible that if you had your two, so speaking to Moderna and Pfizer, if you had your two vaccines and then 6 months got a booster and another 6 months got a booster, you are in almost the superpower area where, it is very unlikely. I slept with my daughter 2 weeks ago in bed with her. She was sick with COVID. And I didn't get it. It's amazing. And I'm on this medication. So it does function. And it's great. And there's a lot of great science out there. But mandate. Can you go tell somebody and force somebody to do that?
Yeah, so obviously, I would say obviously the federal government, particularly this administration, thinks they can. Mm-hmm. And obviously they technically did not and could not themselves. And so they're using OSHA, Department of Labor through OSHA to mandate employers to do that. And so you have a lot of states suing the administration, particularly the state of Texas. Ken Paxton, the attorney general for the state of Texas, is suing the Biden administration, particularly for these mandates, as well as I know of at least 30 states. 30 out of the 50 states are suing this administration for that unconstitutional vaccine mandate. You're forcing somebody to put something into the body, whether they like it or not. Again, I'm for the vaccine. I got the vaccine. Sure. But the reality is I do not believe that anybody, whether it's a medical or a governmental agency, has the ability to take your God-given right to choose.
Absolutely.
Yeah. And not only that, it's protected by the Constitution that you have that ability on that. So,
and you said that it's the Supreme Court?
So I mean, I know my understanding is that this Friday the Supreme Court took a very active and aggressive stance, and they will be reading and hearing the case. One of them, I don't know which case it is, but related to vaccine mandates.
So here we go.
It's going to be a showdown, and we'll see what specifically happens. So.
That's amazing. So again, being for the vaccine, but against mandates, I agree with you so much. I just don't see it. And I think I think it's more simple than it sounds, that where we all went wrong is for the this extreme of education on vaccines and COVID and then this extreme over here for vaccination and COVID. And it's just all really a lot of opinion and cortisol rising and fuming. And really there's a middle ground of education where people could make a very nicely educated decision about the way that they want to handle it. But most decisions are made on those extremes.
They are. It's unfortunate.
And that's where the fear is.
It is.
Then you mandate, and then it makes it more fearful.
Well, I mean, if you look back at the history, right? So COVID hit the United States November of 19 in New York, right? It hit San Antonio March of 20.
Absolutely.
I think the very first patient, I believe, was like March 11th of 2020. I had my first employee get it March 27th of 2020. Wow. So I created a unit. I've been involved in COVID for literally going on almost 2 years now.
Yes, very knowledgeable.
Been involved in it on both the actual COVID and active COVID, and also the recovering what we now call long COVID, which is you don't hear a lot about, right? So once you get COVID and it takes literally people sometimes weeks, if not months, to get back to function.
I have some patients now out about 9 months, still having cognitive issues, neurological issues, and short of breath. I have one lady still on oxygen. She was previously fairly healthy, and so that's the COVID long hauler syndrome. And I did a show not too long ago about that, about how to look at it and treat it, and it's very real. Well, it's like an autoimmune disease.
It is. So you take average length of stay for a patient goes into the.
Could you say that again?
It goes into like the ER, right? So you have symptoms, you go into the ER, and unfortunately you get ventilated, and I mean you'll spend anywhere from a week to 2 weeks in the big hospital, right? You then can go into what's called a long-term acute hospital. Average length of stay is about 25 days there, and then after that you're debilitated, you're weak, you don't have your strength, right? And then you come into which is where I'm currently at, which is a rehab, right? But you still have high oxygen capability. You still have pulmonologists and critical care intensivists and cardiologists and a nephrologist on it, depending on if you had some kidney issues. And then now you're pushing people up, trying to get them to function, getting strength, trying to walk again, getting back. And these are working class teachers and shop workers and so you're talking weeks to get them back to some type of normal function. That's what COVID has done to this community and honestly the world.
Well, and with that, if you think about all the people who are just out for 10 days, all the people right now, I mean, that's why all these places are closing. Well, and we're losing money, and businesses may risk closing again. And
go back to what you mentioned earlier about healthcare, right? So the CDC just changed Monday of this week. No, maybe it was last week. I apologize. Monday of last week from 10 days to return to work back to 5 days if you're an essential worker.
If you're vaccinated, I thought.
Well, there's a lot of criteria.
Exactly.
So
it's very heavy criteria.
It is heavy criteria, right? So it's vaccination. It's also signs and symptoms, right? It's still there, right? So if you're still exhibiting symptoms, they don't want you to return to work. But 5 days return to work. I mean, that's unfortunate. Is that where we're as a community? That if you have, and unfortunately, it's a very transmissible disease. They just change their stance on the face mask too.
Right.
The paper face mask, they're now officially saying it obviously has not stopped COVID, which many people have been saying, especially in the healthcare community,
that
it doesn't, right? I mean, I've run units with
that's so true.
aerolized bugs, and the only thing that works is an N95.
Exactly.
Right. So.
Well, they're trying. I read something too, study-wise, where they feel the cloth masks work better than the paper ones, and they want the community to wear more of a cloth mask, but reserve the N95 for healthcare workers. And so that's kind of the new thing. It changes every day.
It was just funny. I remember at one point we were all wearing like 3 cloth masks, and then it's just
how far we've come. How far we've come. I know. Well, I want to visit with people just a little bit and let you know we're about to come up on a break. There's several places where you can find lots of information, and I'm going to be posting that on my website. So you can find the show not only here radio-wise, but on YouTube and iTunes, Spotify, all these places. And you can go to drpbetterlife.com and look for any of these places to find the show. I will also put the CDC website and all. I'm also going to feature Mr. Sinclair here as well, and it's Kyle420.com, and so that will be there too, so you can find some information, and that is drpbetterlife.com. I want you guys to know about that so that you can start to learn, kind of, even though the CDC is not always somebody that I'm, behind. I think there's a lot of political, behind that too. But that is the resources of what the law is in the land at the moment, and some information. So, with all of this, where do you see us going from here forward? What do you anticipate is going to happen?
That's a tough one. I
can't make it easy on you.
No, I know. I think the reality is again, I stick by, that COVID vaccine is not a true vaccine that eradicates a disease.
Correct.
Right? We don't have measles, mumps, rubella, polio,
right.
chicken pox. We don't have that predominant in the United States.
But we have the flu vaccine where we have to get every year.
And depending on the strand, we sometimes get it as a nation, sometimes we don't.
Right.
But we still have annually 60,000 to 80,000 deaths every single year from the common flu, every single year.
Right.
The reality is that we are chasing a variant of COVID and a virus that continues to mutate, which is why there's a new one. I just read it right before I came here. It's called Fluronia. It's the flu and corona mixed together.
That's right. And
there's literally another variant already they're talking about.
I don't know how these taglines become so popular so fast. I heard that yesterday. But
that's the reality of what's going on this virus, right? And this is a true virus. This is so.
And at some point, our evolutionary status is going to have to weed it out, and I think it takes a large part of unvaccinated, vaccinated, to herd it through and get it done. I think we're reaching it.
It's probably going to be almost like a common flu shot. It's going to be something that we're going to try to hit the right coronavirus strand of whatever variants out every single year. I mean, I got my flu shot.
And there are some oral medications and things coming out. So lots of things changing. So there you go, pharmaceutical world. You've got us all now, don't you? But we are going to take a short break and come back on the other side and talk a little bit more with Mr. Sinclair about some of the COVID issues and what we can do about it.
Fatty liver is linked to two different situations, alcohol and diabetes or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and/or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-982-0320 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Hello and welcome back. We have had a great first half of the show today. I always love visiting with Mr. Kyle Sinclair here, not only about the whole hospital system. He's been a CEO of Warm Springs and Thousand Oaks for very long in healthcare for a very long time. So he's very knowledgeable about that, but also running for District 20 Congress and a Republican nominee. So I'm very honored to have him here today. And we've, in the first half, we talked a lot about staffing issues, lack of testing and things like that. So where do you see all this go? Is there any solution?
Yeah, I think honestly, I would say, and we talked a little bit about the mandates, right? And again, I think we've mentioned on the last show that the clinical staff, whether it's physician, nurses, therapists, CNAs, everybody's involved in healthcare, took care of at the time, a deadly disease that we knew nothing about.
Right.
Yeah. In 2020, CDC didn't know about it.
Exactly.
The local Metro Health physicians didn't know about it.
Right.
I mean, I remember spending 15, 16-hour days speaking with, a dozen physicians on what's going on, what have you heard, just trying to figure it out. That group literally became heroes, right? Because you jumped in, nobody stopped working, we didn't get a takeoff.
I didn't close.
I didn't stop. Hospitals are functioning. And you just tied your bootstraps and you went at it. But that group, unfortunately, this past year has been under massive attack.
Yes.
And I would say in regards to solution and fixing problems, that's one of them. You gotta you can't go from a hero to firing him in 1 year, right? If you don't want to get a vaccine. It's that individual freedom. So I would say that's whether that's a national thing from the Biden administration or whether that's a local employer decision, that you continue to work with that group of population. If they don't want to get vaccinated, there are ways and means to be able to protect them and your organization. It still accomplishes the goal of staffing the needs for this city. So that's definitely one. And as we saw with this Omicron virus, and as I shared, it doesn't matter whether you've been vaccinated or not, right? And so I think that's definitely a solution for this community, and particularly the healthcare community, and some of the shortages that we're seeing is get back to that. I know at one point the nation was using massive contracts to help supplement staffing needs, and we saw a lot of shortages across the city for that.
Absolutely.
As you saw pop up in New York, some people from San Antonio would grab these contracts that were paying ridiculous amounts.
Exactly.
So you literally, as a nation, and sometimes even in the city, you're robbing Peter to pay Paul, right? You saw nurses go from a Methodist system because they made X amount, and Baptist was offering this, and so they went to Baptist.
Exactly.
Right? So that's some tough things, but that's definitely a solution, is being able to work together as a healthcare community, which is my understanding, the number 2 employer is healthcare in San Antonio.
Absolutely, it is.
Yeah, I mean, what are your thoughts? What do you think that would help drive solutions in regards to?
Boy, you'll get me started. There's so many different places where there's so many different needs in order to fix it. And so it makes it hard. And I feel like it's education, honestly. I feel like the more that we understand about what we're facing and what we're trying to do, and realize that we're a community doing it. And so instead of putting somebody on the defensive of, well, it's my body, my right, and we're concentrating on that, yes, it is your body, your right, absolutely. But instead of focusing on that, focus on, well, it's my body, my right, but I want to do this for you. I want to protect you from getting it from me or your family, whatever it is, vaccinate or not. If I'm an employer, work from home and, keep everybody or, distance everybody in the office or whatever it takes. I just think that the more that we put people on the defensive, the more we're going to continue to spiral with misinformation and, this is me versus you, when really we're all together in this. I mean, I get up with the same thought as somebody across the city, on the south side that wants to be healthy and protect their family and make money and, pay their bills. We're all the same in this. So I want to protect him as much as I want to protect me.
Yeah.
But whenever people are coming to the office and saying, so-and-so told me that I was going to die if I took a shot. I'm like, so I don't want the vaccine. I don't want to be forced to it. Well, I don't want you to be forced either, but I want you to understand, no, you're not necessarily going to die taking a shot. So whatever it is, just education. And I hope that makes sense. But
no, it does. And that's partly, when the vaccine hit the city, I want to say about November of 20, November of 20. I got my vaccine November of 20 as well. When it first hit the city. And so, or December of 20.
December, I think it was late.
Yeah, so that's when I got it as well. And partly, my decision to get it was to help minimize risk and exposure and symptoms if it, and or death, unfortunately, if it came that with myself. And that was a personal decision I was able to make talking. But the reality is I think that's a very personal decision between you and your physician.
Right.
And again, as we shared, as I stated, and I think you shared as well, is that the government or agencies should not be involved in making that choice.
Absolutely. I believe that 100%.
Regardless of your political stance or not, we should not have a president of the United States getting up there calling out that our patience is wearing thin for the 80 to 100 million unvaccinated Americans. That's not how you
If they don't want to vaccinate, we need to come up with a reason to help people. They don't have to vaccinate, but what are we going to do with that?
But again, as you saw with the Omicron, it doesn't matter if you're vaccinated or not.
Right. So, and to some extent. So, but you know what? Does that 7 minutes not just go really fast? Because there she goes. But I'm so glad everybody joined in today. Thank you very much for having me. Thank you very much for being on with me again. And we're looking forward to February too, I believe. And so going fun to have him in again. And so please go to drpbetterlife.com, where you can find all of the links regarding the show here for YouTube and podcasting. Also for Mr. Sinclair here, Kyle4, and that's FOR2020.com. All of that information will be on there. And I hope everybody has a wonderful day and a Happy New Year. Thank you.
Thank you.